Now, security agencies have been told to clamp down on persons and institutions flouting the COVID-19 safety protocols. Cases have been rising sharply in the last few weeks, sending the country's case counts to 1,156 from a low of 150 last month. Markets and workplaces have been identified as the high-risk areas, as many refuse to wear the face masks. This morning, the country's COVID-19 management team has been addressing the issues forcing the surge. Here's Director General of the Ghana Health Service, Dr. Patrick Kuma Abwaje.
Our active cases stands at 1,320. Now, but you can see the regional breakdown. The significant number of all the cases, about 861 of them, is from Greater Accra alone. So, accounting for almost over 70 to 80% of all the cases. We've following about 3,835 cases. The number of hospital beds, this is not the number of people in the hospital, the number of hospital beds available. Still, our hospitalization is very, very low, as I mentioned earlier. We have 926 beds available in case of a surge. Our isolation capacity is 744 across the country. Greater Accra has 140 now because we are no more using the Pentecost Convention Center, which was given about 600 beds. We have about 67 ICU beds for COVID, and we have 259 locations for quarantine. So this is just giving us the level of our preparedness as a country. Even though we are rising, we don't have high hospitalization and number of critical cases. So this is where we are all going to ensure that we work towards bringing these numbers down. We've also done something about face masks. I'm sure we shared it here before. We had done a series of almost 7 surveys in Ghana, mainly in Accra. The regions have done that, but this surge is currently in Accra, and so we are focusing more in Accra. Now, of that, the sample so far we've done, total sample size used about 95,372 people have been surveyed. And the first one was in August, and all the way, the latest one was in early October when we did the survey. As we had mentioned earlier, we did Abobloshi, Makola, Kaneshi, Malata, Tema Community 1, and Ashama were the carriers. We did that. We also did some shopping malls in Accra Mall, ANC Mall, West Hills Mall, St. Junction Mall. We had also done an assessment in the streets and lorry parks across the country in the area that had been mentioned, and also have followed people on some trotro route to see what's really happening as people move.
You're live on JoyNews today. Now, Information Minister Kojo Ohoa-Nkrumah has directed the security agencies to begin a clampdown on those flouting the directives.
We have reiterated our call to the security agencies and to the operators of activities in enclosed spaces to ensure that there's compliance. Our general approach has been first, even using the security agencies, to do more of education and urging compliance. So you would find that when enforcement was a bit higher, when the police or other agencies engage, they seek to urge compliance rather than seek to arrest and prosecute and detain. Because as we mentioned, the intendment is to get compliance rather than, and if you look at these numbers, rather than arrest these millions of people and seek to prosecute and to jail them. So the idea has been to urge compliance, and that's why this morning we are reiterating that call that the security agencies and operators of activities in enclosed places should do more of that. The President mentioned last night that it appears that we are letting down our guard. And so it is a collective responsibility matter that we all have to rise up to.
Now, Bismarck Kweku Asante has been at this news conference and joins us with more. Kweku, we understand the Ghana Health Service has been sharing insights into a survey it's conducted which shows the number of people wearing masks are going down. Bismarck, tell us more.
Well, Daniel, so Dr. Patrick Kumar-Boaji of the Ghana Health Service has been sharing some numbers, and the numbers are pretty staggering. He's been saying that they conducted some surveys in markets, truck terminals, and also even in some closed workplaces, among other things. And that what they realized was that the number of people who were wearing masks as of the time that the Ghana's case numbers were very high have moved from 44%. That wasn't even up to 50%. It has moved from 44% to now 10%. So people who are wearing masks have really gone down. And then in terms of this one that is really scary are the people who are not wearing the mask at all. According to Dr. Patrick Kumar-Boaji, 18% of people, 18% of Ghanaians used to wear the face mask. But now 72% of the Ghanaian population, especially those who were surveyed, do not wear the mask at all. Those are very, very interesting numbers that have been coming in. And that comes on the back of Kojo Oponkume's suggestion that the security agencies must really do enough to clamp down on Ghanaians and other people who are not wearing the mask, who are not paying attention to the COVID-19 preventive protocols. Daniel.
Now, Kweku, what is the government saying about the cases being recorded in workplaces, which they attribute to the surge in the country's numbers?
Well, so Daniel, I asked the question to the Information Minister and then to Dr. Patrick Kumar-Boaji that there have been suggestions that the rise in probably is the data they have seems to suggest that there are a lot of companies that are recording cases and not political activities. They went ahead to cite some situations where they say that there are some workplaces where if persons record cases, they just send it to some private lab to run the test. They ask those people to go home without conducting tests among other people that they might have contact to. And so Kojo Oponkume is saying that a lot of companies, fishing companies, among other things, they did not mention those specific companies' names, but they've been saying that those have been the reasons why the case numbers have really been increasing and not because of political activities. Daniel.
Thank you very much, Bismarck Kweku Asante, for those updates from the news conference.